welcome to our speaker series today. We're going to give it a few minutes, let everyone join us. I think we got about maybe another 45 seconds or so until our actual start time. So we'll give it just a couple more seconds. But I'd like to welcome everyone to this topic. It is our April speaker series topic, and it is on integrated healthcare and also whole person care. And I'm really excited to be joined by Eric Christian today. Eric is the Director of Behavioral Health for Community Care of North Carolina, and he's also a licensed clinical health counselor. So hello, Eric, and welcome.
Great. Thank you for having me. It's an honor to be here with this group that I've learned so much about, and you'll understand why in a little bit. But
Yep.
um,
Yep.
so
Eric,
let me know when we can get started. I'll introduce myself and
absolutely. So just a couple of housekeeping notes before we get started. So just a brief reminder that this is for educational purposes only. And if you have any special personal questions, we highly recommend that you actually just see your doctor about that. But if you have any questions that are more of a general nature, please go down to the Q&A box on the bottom of the screen. We'll be answering questions live. We also have some questions that were previously submitted, so we'll probably start out with them, but we're hoping to get it to as many questions as possible. And we'd like to thank you to our sponsors for helping us and supporting us through all these wonderful programs that we can bring to this community. Eric, I'm going to kick it over to you to do an introduction of yourself, and we can get going with our conversation.
that's great. Thank you. As mentioned, I'm a licensed clinical mental health counselor in the state of North Carolina. I'm a nationally certified counselor. Goes back to about 1999, so before the millennium. And I've worked in various behavioral health settings in the last 15 years, I've worked most often with medical providers to integrate behavioral health into medical settings, most often primary care and your pediatrician setting, so that someone's right there working alongside your family physician and can be right there, accessible, break down some of those barriers, even if it's just distance across town.
Yeah, that's wonderful. Wonderful field to be in. So we talk a lot about, we hear a lot about whole person care and integrated care. Can you explain exactly what that means and then kind of draw the line over to why that might be important for somebody in our community to know about?
Sure. Whole person care can be done by any one provider. It really is
Mhm.
the ability to sort of recognize that we're multidimensional, that we have physical health needs, we have behavioral health needs, we have emotional and social well-being as part of our individuality, and aiming to sort of look at all of those components and optimize them all together for sort of the best, more well-rounded outcome. So, if you're not feeling well physically, it's going to impact your how you feel mentally, and vice versa. And so ignoring one of those items and sort of your social well-being can really impact your health overall. And sometimes when we're not feeling well in any way, and certainly for folks that are related to the CIDP and GBS Foundation, that might be neurologically,
Mhm.
we might have other sort of areas that are lacking, like our social connections and things like that. And that will, over time, impact our ability to take care of ourselves.
Yeah, absolutely. So are there specific services that would be considered something you should seek for this kind of whole person care approach?
Sure. You may think about the providers that you have, and I know some have many, and how their bedside manner might vary, and some are asking you other questions
Yeah.
that might be outside of what you thought you were going to be discussing that day, asking are you sleeping? How are you feeling? Are you anxious? Or, how are your symptoms of depression if that's something that you suffer with? And so definitely lean on those providers. But if they're not asking those questions, and it is part of what you're struggling with, it might be important to find ways to mention those sorts of things
Yeah.
so they can understand, oh, well, I haven't been doing as well in this area with my mood, and perhaps that's impacting, how I'm feeling today, how I'm presenting today. It's something I'm working on. And so when you see providers that sort of address the whole person, great. That's
Yeah.
showing you what they all could be doing,
Yeah.
but perhaps they were not taught that way, or there's a lot going on and they're not getting to those points. So it's important to mention them.
Yeah.
And you mentioned sort of integrated care. That would be where we have different types of providers in one setting,
Mm.
such as having a behavioral health provider in your family medicine setting. And that certainly allows for more opportunities for a whole person approach because we're bringing in other professionals who are just going to expand, you know, the way things are looked at in the practice and the way that things are addressed.
Yeah. Yeah. So if there's not, which is a wonderful model, I know that's the model that you work for. But if that is not the case, how would a primary care, let's say, person reach out and provide those services? Like, how does that
Sure.
actually work?
Sure.
Uh,
So
yeah.
everyone should have a primary care doctor, even if you feel like
Yeah.
the one that you need to go, the doctor you need to go to is your neurologist, still keep
Hmm.
up with your primary care. They are your medical home. And
Yeah.
they're supposed to coordinate treatment, but if they don't
Yeah.
know what you need or where you're going, then it's hard for them to do so. So disclosing that I also see this therapist would be helpful to make those connections. But typically, they have trusted referral sources for neurologists, for endocrinology. Think of all the specialists that are out there.
Yeah.
They may not have as a good of an array of referral sources for therapists, for mental health therapists,
Hmm.
but are always looking for those resources. So they can make those connections. I know sometimes uh, they may give you a list of providers, and you need to look at the back of your insurance card and determine how, who might kind of fit or who's in network. Those
Yeah.
are good places to start. And we'll talk a little bit later, I think, about how to pinpoint some of those things. But that primary care provider typically is that referral coordinating
Yeah.
source and has
Yeah.
a referral specialist that would lean out and connect you with neurology and with the
Yeah.
other types of providers that you may need.
That's great. And do you think that patients should kind of take it on as their own responsibility to bring a list of services or kind of expertise that they're looking for, and give it to their doctor and say, I need a psychiatrist, I need a physical therapist. Is that like to bring something with you? Do you recommend that?
I, well, definitely bring your med list wherever you go.
Yeah, yeah, yeah,
Put it on your phone, keep it up to date. These things change often, as you know. You might say, "Oh, I don't take that one anymore," or it's as needed, PRN. So
yeah,
bring the med list, but also the list of your other providers and
yeah.
who they are, and then things that you might need. So
You might need, yeah,
certainly, primary care provider is going to be first in line to prescribe things such as an antidepressant or something for anxiety or sleep. But when they feel like they're getting a little bit beyond their scope and
yeah.
comfort, that's when they would refer out. So I would start there,
Okay,
and then see who they work well with because you want that communication.
yeah,
They
yeah,
may say, "Oh, there is someone across town that when I feel like I need a little help, that I refer to." Just like some basic things might be handled in primary care, but then for allergies but then when they need more help, they refer out to the
yeah,
specialist, right? So it starts there at your medical home, and then you get more help as needed. Everyone probably on the call has a neurologist. You may have started at primary care if your condition crept up slowly,
yeah,
and then they referred to neurology, or unfortunately, sometimes folks hit the ED as their first stop. And so
yeah.
that didn't happen with primary care because it went right to a more emergent situation.
Right, right. I like it. You called it your medical home. I think that's a good way to think about that, kind of like your home base for all of your needs, right?
They're
Yeah,
supposed to be the hub and
yeah,
coordinate and know where you're going and all those
yeah,
pieces.
yeah,
And so when they ask you who your primary care is when you're at your any specialist, that's
yeah,
because they're going to send records over there, and they
yeah,
get all the little pieces, maybe not the in-depth portion of the record, but the summary.
yeah,
So they
yeah,
understand, oh, they're providing these meds, let's not duplicate them. Oh, that's your treatment. And they would incorporate that into their overall plan of care.
yeah. Great, great. So, switching gears a little bit, what benefits or improved outcomes have you seen from people using whole person care or integrated healthcare?
So typically there's I see just sort of benefits all around because you're informing your providers, in this case, of your peripheral neuropathy.
Yeah,
So if you're bringing that scenario to, let's say, a behaviorist, a therapist, you're probably going to be in the position of educating them as to what your condition is, how
yeah,
it impacts you, and that therefore your plan of care would kind of have that in mind.
yeah,
Just like if you were starting to work with PT or OT, I know this is really common. It was for my wife. And you don't mention that you have a neuropathy, but that you're trying to get better balance and a little bit more strength, you're probably going to end up overdoing it. And they're going to be encouraging you, unbeknownst to them, to do things that might overdo it. And you might,
yeah.
if they're educated, probably through you, on
Mhm.
what your peripheral neuropathy means, then they're going to start lower and go slower and be more mindful of just sort of, what pacing you might need and intensity. That's going to get you to success a little faster. Same thing for if you're working with a therapist, informing them on your condition, and that perhaps, after my medication, I feel a little cloudy. They're switching it to the evening so that I sleep that off. But that is why I'm presenting this way today.
Yeah,
You know, and it will help kind of design a better treatment approach. So that
yeah,
increased understanding, I think, it encourages providers to have, and yourself to have more compassion about the way you approach things,
yeah,
and to be mindful. And most importantly, as you all know, with neuropathies, the pacing that's involved.
yeah,
With that. You
yeah.
can pretty much
And
overdo it without, in my wife's case at least, without too much effort if you're not mindful
yeah,
of
yeah. And also to
it.
inform your practitioners that it is a rare condition. That's
Yes.
another thing because you're dealing with such a unique situation in all aspects of life. So knowing that it's rare is really important as well. So you brought up your wife, who's a lovely volunteer for us, who we love very much. But so can I ask you from the perspective of being both a professional caregiver, or both a professional and a caregiver, I should say, in this field, what is the team? What is the integrated team that you think a CIDP patient or GBS patient or even an MMA patient should really have? So they have their home base and they have their team. So who's on that team?
Sure. I think there's kind of two teams to talk about. It's
Yeah,
the one in your home base and then the one in your, starting from your medical home. So we'll start
yeah,
with that medical home. So having a ongoing relationship with your primary care provider. Typically, there could be other things that maybe you haven't been taking as good care of because you're so concerned about your neuropathy. And that happens for folks. They may not be paying attention to their blood sugar if they're have diabetes because something else seems more important. And so that's going to help you to sort of connect um, and address all of your conditions versus just the one that stands out the most. And then they can help, as mentioned, connect with, of course, your neurologist and other professionals as needed. And then the other team that I think everyone might need to kind of think about is the team that we have at home, and that's your partner, your spouse, your children, your close family members, friends, neighbors. How are they part of your sort of overall plan for wellness? Many of them probably have made outreach. How can I help in any way? And you may not know if you haven't really thought about that ahead of time. How could they be helpful to me?
yeah,
How can they be helpful to me without overwhelming me?
yeah,
And how can I express where, why I'm thinking about that? And what it really means. You might need to educate them about the condition, and that may need to happen more than one time.
mhm,
Because they may just grab onto one thing that you said and not really realize other things like, oh, I do want to go out socially, but I may have to turn you down last minute because today I'm not feeling well. I hope that's going to be okay. Not
yeah,
intentional that I'm doing it. But that sort of creates that empathy and that team that you're looking for so that
yeah,
you create that flexibility with your home team. Um,
mhm,
and, just sort of getting more out of those relationships making them deeper and stronger. And who knows, maybe there are ways that they can depend on you too, and you can
Yeah.
give back. It may not just be something that you think of right away until you're a little bit further into that newer relationship with them. I know sometimes we lose friends with chronic illnesses because we haven't been able to keep up,
Yeah.
and re-engaging them often will work. It's just got to be in a different way.
Yeah. Yeah. So bringing them into your experience, right? Bringing them into the
Mhm.
conversation. We had a friends and family coffee chat last year for that very reason. And it was really successful, and people seemed to really have a better understanding of what their friend or family member was going through. And I think that way they become a better quote unquote team member as well. I would also just add the foundation. I'm assuming that you and Diane, but I'm going to let you speak to this, consider the foundation community as part of your team.
Most definitely. And sometimes I'm the technical advisor in the
Yeah,
background for the local chapter meeting.
yeah,
And so I do participate and really get to see the opportunity for sharing with peers, learning from peers. When you hear that someone else is, going through something that you're going through, it goes a long way
yeah,
to normalize things, to help you feel like you're really actually doing what you should be doing,
yes.
because you've heard someone else is getting the same outcome, from having the same sort of issues.
All right. We do have a question that just came in. Someone has a question about PCP helping with managing mental health. So primary care physician. I think you touched on this a little bit,
Yeah,
but maybe you can give a little more of a scope on how you can work with your primary care
sure.
physician to get that mental health support you need.
So it may not be known to many, but primary care providers, pediatricians, family medicine docs, internists prescribe the bulk of psychotropic medications,
Hmm.
mostly for frontline conditions like depression, anxiety, sleep, ADHD. So 70+% are actually prescribed by primary care providers. So that means that the rest, the 30, 25% or so are prescribed by psychiatry
Hmm.
professionals. So that's how many sort of go outside uh, to work with a specialist. We could use more psychiatry, and perhaps that number that primary care provides would go down that percentage. But they're pretty tuned into recognizing the signs and symptoms if you disclose,
Yeah.
and then starting treatment, even if they then want to refer out for an assessment or for some treatment recommendations. So when it's standard when you go to primary care, you may not notice this, but at least once a year, they're going to ask you a couple questions on a screener. When you fill
Yeah.
out all that paperwork, maybe it's on a tablet these days, or it could even be on your phone when you're doing pre-visit. And you may answer the question of how often during the last 2 weeks you may have had depressed feeling or little interest in
Hmm.
doing things or less pleasure in doing the things that you normally like, or feeling down, depressed, or hopeless. And if you answer anything to those two questions, they're going to follow up with a few more questions to kind of see if there's something more that needs to be looked at. And that really tells you that those are issues that they want to hear about, that they're going to
Yeah.
incorporate into that plan of care. And
Yeah.
again, depending on the severity of what they hear, they may start a medication. And we know that medication plus therapy, psychotherapy, has better outcomes than either one alone.
Yeah.
So if you're not getting traction with the medication that you've been on, perhaps it needs to be at a different dose or a different medication might be used. The medication can't really help you apply skills, interact with people. It can just take that big burden off and maybe allow you to be in a space to where you can even think about interacting with others.
Yeah.
But it doesn't provide those life skills. And so that's why the addition of therapy can be helpful.
Hmm.
But definitely, we know that the bulk of those medications begin in primary care, and then when they need help, they go to a specialist, just like something for an
Yeah.
endocrine-related condition or any other
Yeah.
condition that you might have. They start in primary care.
So can I ask you, other than a psychologist, and outside of primary care, if you were to seek somebody to help you with emotional support, are there other titles you should look for?
Sure.
Clinical social worker, or what other
Right.
titles should you be looking for?
Yeah, and maybe so we can send out some links and things on that. So
Yeah, yeah,
often we hear
absolutely.
psychologists and psychiatrists. So think
Mm,
psychiatrists for medication,
yeah,
management, for overall treatment. But then when you're talking about psychotherapy or testing, that may start with a psychologist as sort of your thought about who might fit that category. But there are folks such as myself, licensed clinical mental health counselors, licensed clinical social workers, licensed marriage and family therapists,
right.
who all can fit the bill.
Yeah,
And often they try to specialize in a particular area, so that might be where you're making some decisions. Usually, you can look them up. There are some good resources for looking them up and putting in your insurance and seeing what comes out, and then you can look to see what their specialty is, whether it be depression or working with depression and children versus depression
mm,
in adults. Like, some people
yeah,
just treat one end of the age spectrum, or are they a specialist for eating disorders? They may not treat
right,
depression. So you just got to kind
right.
of know what they're working on. There are lots of there are generalists, but there are lots of subspecialists.
Yeah, great. That's great. And yes, we will send out links to that and any other resources that Eric provides. So don't worry about taking too detailed notes. Everybody on the call will get an email. We have another question that came in and said, what if my doctors are part of two different health systems? I think that may be referring, yeah, to what you had said earlier about being within a health system to get
Yeah.
referrals. Yeah.
There are certainly advantages because often there's a little bit more data sharing within the health system.
Mm,
Sometimes they can see the note of the other provider, or at least the care plan, once it goes out of that system. And that's often like with a hospital based. So maybe you go to this hospital system and you're getting your primary care from them, but your neurologist is outside of that system. They're a private
yeah.
entity. The notes still should be sent and care updates and things like that. But you may have to do a little bit of background work. I know we do
Yeah.
all the time playing our own care manager to
Yeah.
call ahead of time before you get there and say, "Did you get the note from the other provider? I
Yeah.
signed something, I called." Sometimes it still doesn't work out, and you may need
Yeah.
to sign when you get to the other provider or release, and then they'll request the records.
Yeah.
Eventually, though, the connection will be made,
Yeah.
but it is a little easier within one system to assume that the information is going to be ready at their fingertips, even if they didn't know it was there. They may not know you go to the other provider in the system, but when you tell them, they can dig for it a little bit more easily. So in some cases, well, and often you end up
Yeah.
playing care manager for yourself to get these connections made. Usually providers are glad to work with one another, but it can be challenging if they need to see the scan, they need to see, the assessment from the other provider, and you don't have it in hand. Sometimes, though, I know we brought printed records just
Yeah.
so it's there
Yeah.
that day, and then you sign the release for that connection.
Yeah, yeah, that's great. Good advice. Good advice for everything, actually. Make sure ahead of time they have the information they need before you go to your appointment. It'll save you a lot of, frustration.
Yeah.
So, okay, we're going to pivot a little bit over to the counselor side of Eric. And we've talked a lot about whole person care and what integrative care means. But I want to dive a little bit deeper into some practices or advice or exercises, Eric, that you can recommend for kind of handling stress on a day-to-day basis and handling all of these kind of traumatic situations that people are finding themselves in while coping with these conditions. But first, I will ask, what mental health challenges are most common for individuals, would you say, with GBS and CIDP?
Sure.
And their men?
Certainly, if you have struggled with any condition, it may be a little bit worsened because of the stress of the neuropathy, right? So if you're a person that you know has struggled with anxiety, sometimes you feel overwhelmed. It keeps you from.
I think you might have froze. Hmm. Just bear with us for one moment. Having a little tech issue. And we will be right back online. Yep, we're going to have Eric log off and log back in. We will make sure that he gets back on, though, and able to give us this amazing information that he's providing. My producers are busily chatting back and forth, trying to figure this out. It is a good opportunity at this moment, I would say, to type some questions in if you have them, though. Well, it looks like Eric is back.
I am back.
You're
We were
back.
talking about
You
the
froze.
efficiency
That's all right.
online.
It happens.
Yeah.
Now I can't see you, but I hear you. And if that's all we have, that's all we have for now. Do you have your camera on?
I'll click. Let's see it.
Ah, there is a thunderstorm that is affecting the area where Eric and Diana live. So that might be what's happening.
Can you hear and or see me?
I can hear you. Do you want to, can you hear me? Can you hear me? I can't see you.
Yes.
Yes, you can hear me. Okay, so we can just keep going until the videos. Oh, there we go. You're back, but you're frozen.
I'm gonna try one more connection. It may blip first.
Okay. No problem. Everyone's getting a behind the scenes look. This is what happens. This is what happens in live TV and live speaker series.
How about now? Is that any better?
The video's not great, but I can hear you. So that's kind of the most important thing.
Okay. Sorry about that.
All right. That's okay. No problem. What are you going to do? Thunderstorms. No control over that. Okay. So we were talking about the most common issues that might happen with someone who's facing these conditions. And so if you want to have any more on that.
Sure. Well, as mentioned, I think before the internet went out, if you already have any related mental health condition, it may get a little worse. When you have physical health conditions that are stressing you, but sometimes by having some physical health conditions such as CIDP, GBS, MMN, we may learn that we have some new kinds of concerns with anxiety, or certainly depression over time. If you're feeling sort of a loss of control, loss of direction, or just sort of the stress of life interrupted. No one has planned for an episode of CIDP, GBS. It's not something anyone was thinking about.
Right.
You probably never heard of it before you had it. And then things change, and they can change drastically, and readjust, where you think you were going with your plans for your future and next steps. And so it is important to kind of be mindful of that, because often folks who struggle with anxiety, depression, or a mental health condition do worse in maintaining their physical health conditions.
Yeah.
So those who have severe and persistent mental illness, in general, die 25 years younger than the general population. It's not from the illness itself. It's from the physical health condition that they're not maintaining. That's most often hypertension, diabetes, congestive heart failure, COPD, and things like that. But when we're not feeling well up here, it can affect our ability to take care of the rest of our person.
Yeah.
And so that is the balance that we're talking about, like the whole person. And we've got to, keep up with our physical health conditions, how we're feeling behaviorally, our social and emotional sort of well-being, all matter.
Yeah, yeah. So, Eric, any advice on how someone might be able to handle kind of the emotional highs and lows? Like, you might get the diagnosis and we finally have a diagnosis, and then you realize, oh my gosh, I'm going to have to deal with this condition. There's a lot of ups and downs. This journey,
Yeah.
goes all over the
Well,
place. Any advice on that?
first and foremost, and you have already all done it, is connect with the foundation. Uh,
Yeah,
realize that you're not alone, that there's supports, that they know more than you probably do, and can help with those very important next steps, of course, which are getting to one of the centers of excellence for a complete workup. So
yeah,
start there,
yeah,
but then I think just recognizing that you may have experienced similar feelings before, maybe not as intense, of having a difficult time, and the that it will pass, or at least the most difficult point will pass a little bit, so that you can then act on it. It may feel like it's just insurmountable, all of this that's changing all at once. But if you stick with it and lean on your home supports and your providers,
yeah,
typically that spike will pass enough to where you can start to act again on it and lean on folks who can help you to act on it,
yeah,
especially when you might need help getting to appointments and all the other things that happen throughout your day.
yeah.
But do remind yourself that you're strong. You've dealt with other challenges before, that you're resilient. This is
Yeah,
just going to really test your resiliency. So,
yeah,
uh, that resiliency is different in different settings. You might think of your ability to, maintain composure around friends versus when you're talking with your siblings. Maybe you're just less
right.
ability to tolerate frustrations with them. And so your resiliency zone is smaller. But this is going to test that zone. And
Yeah,
sometimes we feel like we're stuck on high, things are out of control, or we're stuck on low where you feel like you can't really do anything. You're not able to mobilize. And I think just allowing yourself to kind of get back into that zone to where you can start to take action
yeah,
supports yourself and can start that sort of domino effect and moving in the right direction.
yeah, yeah. So I like that resiliency zone. It's good to think of it as something that's flexible, adaptable.
It
Um,
is, and the more that
yeah,
you recognize it and sort of go after like the next thing that you need to do, the more you kind of strengthen it and widen it.
yeah,
Think
yeah,
of that person that gosh, he or she is unflappable in the most difficult situations. Well, it may be part of who they are, but they may have worked
yeah,
on it quite a bit, and over
yeah,
time,
exactly.
it gets strengthened.
That's
You may
it.
think, well, I could never, do that. I could never deal with, having a job like that. Like I couldn't be an EMT. I don't really like blood, but I'll faint. But if I
Right, right.
interacted with over and over, eventually I would improve my ability to deal with it. I would
Yeah,
strengthen my resilience there and be able to accommodate a little bit more of it. So
yeah,
this is gonna test your resiliency. I'm sure you know it already has, um,
yeah,
but you probably have strengthened it over time, starting with just making connections and getting your health on track, having a plan of action that you can
yeah,
then talk about with others and feel good
yeah.
that you're on the right path.
Yeah, yeah, that's a really good point. It's amazing when you pull back the curtain on someone who seems so strong and has it all together and they're so centered. They probably have a very routine practice on how they've gotten there, and they've probably been doing it for years, right? Um,
Yeah, you might ask others, how do you do
yeah,
it?
yeah, exactly. How do you do it? So we have a question from the audience, which I will give you, and then I'm going to switch over to the practice that we talked about, the somatic practice of something you can do in a pinch when you're really triggered and really, really freaking out, or in the fight or flight mode. But the question first is, with MMN being a progressive disorder, how does one distinguish reality from anxiety in regards to evolving or potentially evolving symptoms? So is it caused by anxiety, or is it actually their symptoms? Tough question,
That
but what are your
is, I
thoughts?
know, sometimes even with pain, there can be phantom pain and things like that. But when we're anxious, it can be hard to um, really kind of sense into what's happening because so much is going
Yeah,
on.
yeah,
When you're anxious, for example, you're kind of stuck on high versus maybe
yeah,
feeling depressed and stuck on low, and things can get pretty scattered.
yeah.
And so I think finding a way to calm oneself,
Hmm.
and then you can kind of see what your baseline is. get rid of some of the static. Um, and so however you choose to do that, people often say, well, what's the best exercise or what's the best therapy for me or what's the best whatever.
Yeah.
Really, the answer is the best one is the one that you'll do, the one that's going to work for you.
Right.
That's why you get input from other people. Ah, that won't work for me. I don't like that, or I'm never gonna
Hmm.
be so zen to go that way, or what's going to work for you. And for
Yeah.
some people, it might be sort of more hands-on, therapies or ways to do things, and for others, it might be something more sort of Zen-like and
Yeah.
relaxation oriented.
Yeah. And
But
many
try
things.
them.
Some people like being in nature,
Sure.
some people like exercising, whatever it might be. But
Hmm.
so again, just getting back to that, I know you're touching on it, but that in that moment of, how can I get some clarity? How can I center myself? What is a practice that you would give someone
Sure.
if they're just in the middle of their day and suddenly they are triggered by the thought of, oh my God, my life with GBS or CIDP? What can they actually physically do?
So there certainly are a lot of breathing techniques, and sometimes they're a little bit overlooked, but they do sort of reset your base. They can reset your baseline.
Hmm.
There are a couple you may have heard of 4-7-8 breathing, and that's really sort of the number of seconds that you
Yep.
hold your breath and how you exhale. The one I like just because it's the easiest, especially if you're feeling anxious or unsettled, is square breathing because it's
Okay.
4 seconds, 4 seconds, and 4 seconds, and so easy to remember
Mm.
and therefore do, and to have in your toolbox. That's your virtual toolbox. Think of
Yeah.
all of the tools on a tool belt. There are a bunch of them there because they all do different things. The hammer doesn't really kind of take care of all of the jobs. You
Yeah.
might need a screwdriver
Mm.
or a particular screwdriver to do something more particular and less blunt. But square
Yeah.
breathing is typically a good way to begin, and we can do that if folks are interested. Maybe take a few minutes and
I
do
think
it.
we could, yeah, take a minute, and if you could instruct us through that, then I think people would get that real
Sure.
experience of how it actually changes how you feel.
Sure. So
So,
if you're sitting or you can take a seat, that would be great. You probably are if you're sitting in front of the computer or maybe
mhm.
you're sitting with your phone. And what you want to do is sit upright and put your feet on the floor, both feet. If you can kick off your shoes, that might be even better, to kind of have the sensation of your feet on the rug or on the hardwood floor. Um, and what we're going to do, and you can close your eyes if you're comfortable doing that. I'm not going to, so I can keep my eye on some instructions
Mhm.
I have here because I have some additional things that we might do. But what you want to do is feet on the floor, sit up straight, and then just inhale for 4 seconds. And then we're going to hold that breath for 4 seconds. So take your time. 1, 2, 3, 4. Now hold for 1, 2, 3, 4. Now we're going to exhale slowly over 4 seconds. Exhale, 1, 2, 3, 4. And then hold your breath for 4 seconds. 1, 2, 3, 4. We'll repeat it one more time. Inhale 4 seconds. 1, 2, 3, 4. Hold your breath 4 seconds. 1, 2, 3, 4. Exhale. 1, 2, 3, 4. And then hold breath for 1, 2, 3, 4. So while you're in that state, leave your eyes closed if you are. I want you to kind of just feel your feet on the floor. You can wiggle your toes a little bit, and just gotta kind of get a sense of your full foot and feet on the floor and the space that they take up. Now maybe feel the weight of yourself sitting in the chair. Just kind of notice your lap and your thighs and how they're kind of holding your weight and the sensation of that. Kind of sense into that. You may notice whether your stomach feels empty or and you're hungry, or that it's full because you just had lunch, depending on where you are in the country or in the world. This one's a little tougher. See if you can feel like the weight of your shirt on your shoulders. You may have to kind of move your shoulders around a little bit to kind of feel it, but it is getting in touch with your senses. Now, how about in your arms? Are they loose? Are they stiff at your sides? Sometimes a little bit of a wiggle kind of brings that sensation um, in front of you. And then going really deep, think about feeling your heartbeat. Can you sense that? Definitely helps to close your eyes for that one. Is it rapid or steady? And then maybe we'll conclude with one more round of the breathing. So take in that breath for 4 seconds. 1, 2, 3, 4. Hold it. 1, 2, 3, 4. Exhale. 1, 2, 3, 4. So just take a minute to kind of come back and open your eyes slowly if they were closed. And then maybe notice, do you feel more centered than you were in terms of how much is sort of going on in your head and what you might have just had on your list of things to do before or after this? And
Yeah.
perhaps that's a way to quickly center yourself, to kind of calm things for a minute, to kind of get back on track.
Yeah.
We do some of these things more naturally with children. We'll say, just take a minute, just sit down for a minute,
Yeah.
because we know they need it, because there's so much going on, and maybe they're getting upset that they, don't feel in control of what they want, and so we do these things very, very naturally for children, but maybe not for ourselves. So
Yeah.
do take the time to do those kinds of things for yourself and see if they make a difference. Typically, they do. It will calm your nervous system for a little bit, clear things out. It's not a total panacea, but it's a step in sort of the right direction. And there's a lot of mindfulness and resiliency training that you can do, breath techniques and things. And they wouldn't be uncommon to have your therapist, if you have one, or if you're looking for one, to do those things with you. Certainly if you're stressed, it would not be uncommon for them to do guided imagery like we did, some breathing techniques, some grounding exercises.
Yeah. That's terrific, Eric. Thank you. I know that I can feel a difference, honestly. So if anyone has any words they want to share in the chat about if that made a difference in how they might feel, please feel free to do that. But yeah, as they say, 3 deep breaths can change the whole course of your life because you're going to make a better decision, right? When you're in a calmer space.
I know it's helped me. Like sometimes I have a little anxiety when flying, and you get in there and you're all strapped in, and that's sort of one way to kind of, get back online. It's going to be fine, but you start to feel that anxiety build, and this is one way potentially to address it.
It changes your whole experience, truthfully. Thank you for that. So have you heard about tapping, EFT, emotional freedom technique? Is that another technique that you would recommend? Do you know anything about that?
I do some. I actually have a friend who's a therapist that does that quite a bit. It can be helpful. It can kind of stimulate sort of our, especially with sort of our temples and things, and redirect, the body a little bit. So it is something that might be, employed by a particular therapist that you work with. It could be something that you look for. I don't often see that listed in terms of like techniques. Typically, they start with some of the more more typical therapies. To say I practice cognitive behavioral therapy or something like that, and then that would be a technique that they would use within. But it is something that's getting more traction. And that you may see that out there. And so when looking for a behaviorist to work with a therapist, remember it's your opportunity to kind of interview them. And so, like whether it's over the phone or a first session, often they will do that with you because they want to find the match. Is this
Yeah.
person and the things that they're going to, tools that they're going to use, are they going to be ones that I think might work for me?
Yeah, absolutely. Yeah, there's just so many tools out. Journaling is another one that I hear people use, right? Just write it out. Just kind of write it out.
It is, and I know when you mentioned journaling, I often think, for folks, in addition to that, that can be helpful. That narrative, it helps you to kind of rewrite, in a sense, what you may be thinking
Mm,
is overwhelming by putting it down on paper. And sometimes we can realize, oh, this is something I can manage, or the way that I wrote it down actually sounds different than what I've been telling people.
yeah,
And
it's true.
so, getting that narrative down,
Yeah,
especially in times of stress, if you feel like it's something that you can do, can be really helpful. And I
yeah.
think in addition to that, keeping your history, I know often for your neuropathy, you might be keeping a history of how you're feeling overall, how you're feeling with fatigue, how you're feeling with any symptoms that you might be having, whether it's numbing or buzzing symptoms. Have
Mm,
they gotten worse? If they're in your extremities, has that changed? Is it working hopefully down your arm and out your fingers and not up your arm?
yeah.
Um, but the same is true for behavioral health. And so often people
Mm,
under or overestimate their symptoms, and that does not lead to a good plan of care. So if you're able to kind of keep a daily tracking log, put in there on a scale of 1 to 10 what your mood was, especially if it's something that's been concerning for you, your anxiety, so that you have an accurate portrayal of that when you go back to your provider to say, oh,
yeah,
actually, I'm having fewer anxious days. I thought it was about the same, but now that I plotted it, I can give you a better report.
yeah,
It's going to lead to a better treatment plan.
yeah.
Maybe avoid
Absolutely.
your medication going up because you're actually doing better than you thought.
Yeah,
And so we don't want the report from yesterday. We want the full report of how it's been since the last
yeah,
time you came in. So keeping the daily is important, not just what happened yesterday. That might just be a spike. We don't want that to
yeah.
represent everything that your total overall outcome.
Yeah, interesting. Interesting. Was we a lot of times we do tell people to keep track of their physical symptoms, not necessarily their behavioral symptoms, but you're right. And also the journaling of it can offer your own self some more different perspectives and different
Mhm.
ways of thinking about the story as you're writing it, right?
Yeah,
So,
there are some therapists who will use like a narrative therapy, and so they'll
narrative
encourage
therapy,
you to
interesting.
continue to kind of keep that log, but then as you're doing better, you may notice that it's changing the
Yeah,
way that you kind of talk about your experiences, about yourself, about others. Um, and sometimes that's used in trauma therapy, where rewriting the trauma kind of distills it down to what it was, and can help a person kind of put their finger on it and do things to then move forward and with that traumatic experience. So
yeah,
in general, the journaling, the narrative writing, and all of that does have its place in many ways, as you mentioned.
yeah, yeah. Awesome. That's great. The connection between your mental health and your physical health. What role does the mental health play in your physical recovery? And how do mental health and physical symptoms interact? So, does your mental health play a role in it? And if so, how does that interact?
It sure does, especially if you have sort of unchecked mental health symptoms, depression that's untreated, and things like that. It's going to impact your physical health.
Yeah,
As was mentioned earlier, that's why your primary care provider screens that when they're considering sort of the big picture. Um, but also when your neuropathy is potentially, if it's out of control, it's getting worse, that may sort of initiate some depressive or anxious symptoms, or if you already struggle with that, it might make them worse. And so ignoring one side and only treating the other, it's just not maximizing your potential.
yeah,
And so they will play into each other, they will impact each other. You may notice that you feel more lethargic and down with your mood when your neurological symptoms are worse. And so using all the tools and treatments available really is sort of that best way. Um, and really can be the indicator when you see one side maybe not doing as
Yeah.
well that, take a sort of a check of symptoms, systems, if you will, and just kind of look at the dashboard there and see what's
Yeah.
going on.
Yeah. Is there, does it also play a role in, I guess this would be considered a physical symptom, but fatigue, like mental health and getting good sleep and mental health and fatigue? There seems to be a
Sure.
correlation there. So any suggestions on that or any resources people can look into for that?
Sure. Depressive symptoms will drag down your energy,
Yeah.
and certainly sometimes kind of impact your ability to get good rest, which then, as many know with neuropathy, starts to a cascade of worsening of all symptoms.
Yeah.
And so it is something to be thinking about. Certainly and you've probably heard this, sleep hygiene is a really important one for
Yeah.
everybody,
Yeah.
not just those with chronic conditions.
Yeah.
Try things like going to bed at the same time every day as
Hmm.
much as possible. Having
Yeah.
a good sleep routine, don't pull up that phone with the blue light. It's really activating at night. If you can put that down, and not use it within an hour of bedtime, that's really helpful to start your
Yeah.
brain kind of relaxing and start moving into that sleep mode.
Yeah.
And so sleep, I think, if it's unchecked, if it's an unchecked area that you can work on, it's kind of a free one. You don't have to go see
Gotcha.
another provider for it, although you
Yeah.
might look online or ask a provider about it, but it's not something that's going to take a lot of energy to do and could have a great benefit. When you may have slept in on a day you don't have to be somewhere, and maybe the alarm didn't go off or whatever or it was dark in the morning because it was raining, how much better you might feel, how much more clear
Yeah.
you might feel. And so when you do get that benefit, think about how your other symptoms are feeling at the moment. And
Yeah.
so do check in with yourself on that.
Yeah. Good thing to journal on that too. Keep the details about when you have a bad night's sleep, how is it affecting you physically?
Yeah,
Right.
so you can put that right up, often people will put, keep their mood, their chronic physical health condition, each of those on a scale, and then how was their sleep that day?
Yeah.
Uh, and hopefully you didn't miss any medications because side effects of missing a medication sometimes can be turn things upside down. But sleep definitely, if it's maximized, something you pay attention to. It can be great. There are a lot of wrist-related watch kind of monitors where they'll give you an
Mm,
idea of your sleep. Sometimes
right.
we may be there for the 8 hours they recommend, but you may notice that your monitor is telling you that you really only got 4 or 5 hours of sleep, that you kept
Mm,
waking and turning. And so what does that mean? Is it something that you can adjust? Was it too hot, too cool, or is there something else going on? And so it can give
yeah.
you a little bit of a inside look. And
Yeah.
some of those sleep monitors are fairly inexpensive. You just wear it on your wrist and then sync it to your phone or your computer. It'll give you the whole month rundown, and you may
Yeah.
notice that when you're improving your sleep, other things start to improve.
And you can purchase them online, I assume, sleep monitors or
Yeah, or like
yeah.
Fitbits, or certainly all
Fitbits.
of the,
Okay.
more expensive
Yeah.
would be,
Yeah.
some of the smartwatches, but some of the Fitbits are, 30, $40. If
Okay.
you suspect that you don't have good sleep, that may be something, or your partner may be able to tell you, yeah, you toss and turn all night. There's no way
Yeah.
I'm getting REM sleep. I know it.
Yeah. Yeah. That's
And so
true.
that may
You
start you
got a
down the
witness.
journey
Yeah,
of
that's
doing
true.
something about it.
Great. This is great. This has been great, Eric. So if we only have a few minutes left, some final question here. I know we talked about joining the foundation community and taking advantage of all of our community virtual events and live events. Do you have any other suggestions for support groups, peer networks, community resources, anything you can recommend for people to stay connected, get connected, and get that
Sure.
support?
Yeah, I think, of course, the foundation and your local chapter connections,
Yeah.
but you may want some additional connections for things that interest you.
Yeah.
And maybe you haven't been able to participate in the way that you were before, but how can you participate? So, if you were maybe volunteering in your child's classroom, but now you can't physically be there? Is there something you can do remotely to help?
Yeah.
Or engage the group that you've been wanting to or you're used to in some way?
Yeah.
That's less physical than maybe you were able to do before, or a new group, whether it's a book club or something like that. You don't have
Yeah.
to. We are not our condition. We are not our
Yes.
CIDP or GBS, and so it's okay to kind of be out there, share when it's appropriate, but to participate in other activities that you're able to, as you're able to. You may not be able to make every engagement, but if you can make occasional ones, and that's okay with participation in the group, then go ahead and
Yeah.
do that.
Yeah.
It's a lot easier than it used to be to find these things online. And if you're unsure, start asking around. I know people participate in the community. I'm forgetting the name of the community local chat
The
thread,
coffee
but you,
chats. Oh, local chats. Yeah. Yeah.
yeah, like who knows about this in the community, and
Yeah.
that crowdsourcing of information is so
Hmm.
it produces results pretty quickly that you can find whatever you're looking for, whatever you're into,
Yeah.
or something new that you've been curious about.
Yeah. That's great. That's great advice. Just it doesn't all have to be about your condition. You can still
No,
have
not at all.
hobbies and interests, and it probably shouldn't be, right? Should
We're
be
so
outside hobbies.
multidimensional. And so,
Yeah.
yes, when things are out of, if our condition is new and it's not really been reined in with
Yeah.
a good plan of care, of course, it's going to be what you're working on. But when it
Yeah.
settles down, you have a good plan of care and you can think about other things and get back
Yes.
to other things,
Yeah.
then it's time to do so. It
Yeah.
will make you feel a little bit more well-rounded and that, your condition is not the only thing
Yes.
you've got going on.
Yep. Whole person care, as they say, right? Um,
Yeah,
so
reconnect with
Eric,
friends. You may
yeah,
have declined
absolutely.
invitations, but they'll
Absolutely.
they'll be glad to hear from you.
Yeah, absolutely. We live in a world where you can do that so easily now
Mhm.
too. So Eric, as a care partner, any final thoughts as a professional and a care partner? We've got 3 minutes left. Anything we didn't cover today that you really want the audience to know?
Sure.
Yeah,
Um, Let your partner know what you need.
yeah,
They may make assumptions and those may not be
yeah,
right, but let them know what it is. Oh, it'd be really helpful if this, or, and this is one that's related to behavioral health. No one wants to hear, oh, you seem depressed or anxious, but if you, as the person who knows you're struggling with it, say, I need you to kind of let me know if I seem a little unchecked. I'm going to be okay with it. I'm not going to get upset with you, but sometimes I can't tell.
yeah,
And so you can help me to be a better reporter and also to catch it before maybe I spiral. And so do lean on your partners, your friends
yeah,
as appropriate, but let them know what
yeah,
you need. They want to help, but they may not
yeah,
really know how.
yeah,
And then if you're talking with peers, maybe through that you met through the chapter meeting, you may get other ideas about how they've kind of, helped their family, friends kind of work with them in a new way.
yeah.
We want to help. We may not know how, and we may step on a landmine here and there. But if we keep coming and asking, take the
That's it.
opportunity. Don't turn that person away.
That's it. That's it. Awesome, awesome advice. Communication, open up to it, right? So thank you, Eric, so much for joining us today. This was wonderful. I think you've really impacted a lot of people's lives today. So thank you so much. We are going to be sending out a follow-up email with any resources that we mentioned today. Maybe we'll have a part 2 with Eric. Who knows? The breathing was great. The breathing technique was great. Thank you to our sponsors once again. And just a couple of things coming up that we have monthly coffee chats. Anyone needs more support, please feel free to join one of our chats. We also have our largest patient symposium of the year in Denver this year. It's September 11th through the 13th, and you can register right on our website. There's lots of information there. Please feel free to reach out to us and let us know, if you have any questions following up this important topic today. And we will see you next month for our May speaker series. And thank you so much for joining us today. Thanks again, Eric.
Thank you.
All right.
Take care.